One of the, I would say, interesting talks that we're hoping to get a lot more engagement and sort of feedback from is really looking at the cancer research priorities in Africa. And this talk is going to be after the conference on the 15th of November at 1700 South African time. So I'd encourage you all to log in and sort of give us your feedback. But I think it's a really critical and key concept behind this, because if we look at the data, we know that cancer research in Africa accounts for, I would say, 8% of all cancer research, really underscoring the gaps that exist. And sort of looking this particular, we'll be sharing our preliminary results around a bibliometric analysis that we had done, but we've clearly seen gaps in terms of the priorities for different countries. And what we've tried to look at is what are the different countries across Africa doing, and what are their research priorities, and are they actually in line with what the priorities of the country are, and also really looking at based on their GDP and their revenue, how much of the research they're doing is actually cancer related. And I think this is important because if we look at sub-Saharan Africa mainly, there's still been a paucity of data around research in general. And if we look at about 2012, we had an African Union commitment to, at least have at least 1% of all the GDP being dedicated towards research. But then that really hasn't translated into many countries. And we're still seeing that despite all the other research that's going on, cancer research is still unfortunately trailing behind. Why is it important and why is this a problem? The simple reason that we do appreciate that we are seeing many clinicians practicing in sub-Saharan Africa or in Africa in general will tell you we're definitely seeing a different pattern of disease. For many of us, what we learned about the disease from the textbooks is different from what we're seeing on the ground, different set of risk factors, different sets of presentations, and sometimes even different interactions with the medications that our patients are receiving, just underscoring the clear need for research along the entire spectrum, whether it's clinical trials, whether it's health systems research, whether it's things looking into neglected areas like palliative or supportive care, or implementation science, really looking at how do we tweak the health system, how do we create strategies that actually help our patients, and how do we measure that these strategies are actually working. And so really looking to see where are we in terms of our research agenda. And the idea is a call to arms, and that's why it's critical to have everyone sort of join in. And we're looking to have a broad conversation around all members, whether it's caregivers, cancer advocates, cancer survivors, healthcare providers, policymakers, scientists, basic researchers, basic science researchers, really to look at what are the priorities. And the idea and the hope is that by the end of this session, we will be able to crystallize what we feel as a continent should be the priorities in terms of research, but then take it to the next level and see how do we adequately motivate and push for these priorities to be realized. And it's the realization that there isn't a one size fits all. Again, Africa is not a country, and there might be different priorities in different countries, but it's really honing down to what are the key areas that need to be progressed, and are we doing enough to actually answer the questions on the ground for our patients. And if since we're clearly not, what could we do differently, or what could we do better going forward to shift the narrative around this? So the background to this particular discussion, and we're hoping that we'll all sort of be able to log in and engage, is this is part of an NIHR grant through the Institute of Cancer Policy from King's College London, and we're basically doing a bibliometric analysis to look at cancer care, cancer research priorities in Africa. And so this is an extensive review of all the literature that's out there, minus the Braille literature in several languages, trying to really look at what are the research priorities on the ground. And we do have a exciting panel. My co-chair, Dr. Werner van der Pooy from Ghana. We have Prof. Richard Sullivan from King's College London, Julie Turode as well, who's a board member from the Institute of Cancer Policy, and Ransi, Mr. Ransi Chidebe, an advocate and really strong proponent of the project Pink Blue, and Salma Mohammed from University, Dr. Salma Mohammed from University of Purdue, who's a basic and translational research scientist. And so the idea behind this is just to share a little about what the priorities are, looking at the landscape of what we know exists currently, and really trying, at the end of the day, trying to consolidate, share our preliminary findings. But to be completely honest, the whole point is to have a vibrant discussion around what should be our priorities. If we can find a way of consolidating and really reflecting on what we feel our priorities are and how far along are we to achieving them. And if we aren't, then what are the next steps that we need to do as a collective continental and international community in order to actualize this goal, and really looking at what would be the practical measures that we would need in order to implement this. The idea is to go beyond rhetoric and sort of come up with concrete steps so that at the end of this discussion as to, and clear steps and strategies as to what we need to do to improve our investment and engagement and research output ultimately going forward, with the underlying goal, as always, that this would ultimately, it's not just research for research's sake, it's how does this percolate down and how does this translate to better patient care? And I think that is still, I mean, the holy grail that we're all striving for. How do we increase our research? How do we generate research by Africans, for Africans, to improve the life of Africans? That is what our ultimate objective is.